scripts. Yeah, it's working. Okay, so this is the case.
Okay.
Okay, once you're ready, tell me to start the 3-minute timer. Shall I? You can see, is it?
Yeah, I can see.
So shall I start the 3 minutes?
Yes, please. Yeah.
Okay, yeah, you
Excellent.
can read.
Mhm. Is there anything below
No, that's
the
on.
page here?
No,
Perfect.
that's on. Hello.
Hello.
Yeah,
Hi.
hello.
Hi. Am I speaking with Joan?
Yeah, Juan, doctor. I'm Juan.
Oh, Juan. Hi, Juan. My name is Dr. Marwa. I'm one of the doctors. Um, uh, can I ask you a few questions? Is that okay?
Oh, yeah, doctor. Yeah.
Excellent. Before we get started, can you confirm your age, please,
Yeah, I'm 35.
and your address?
Uh, as it is, doctor. Yes, in Sandpiper,
Perfect.
23 Sandpiper.
Excellent. Excellent. So, Juan, how can I help you today?
I'm not sure, doctor. Have you seen the photo that I sent?
Yes. Yes, I can see that.
Yeah, doctor. I have this lump in my right upper lid.
Mm-hmm.
It has been a while now, and actually, it's not going. So I'm not
Hmm.
sure. I become worried a little bit.
Ah. Tell me more about the swelling in your eye.
What you would like to know?
Yeah, so you said it's been a while and it hasn't gone away. When did it start?
2 weeks ago, doctor.
2 weeks ago. And since then, is it getting better, worse, or the same?
So as I told you, doctor, is increasing. To be honest.
It's getting worse. Okay. And so is there any pain associated with it?
Well, no, doctor, I can't, I can't appreciate any pain. It's little bit discomfort because
Hmm,
it's making my eyelid heavy a little bit, but
hmm.
there is no significant pain, I would say.
Okay. And is there anything that makes it better?
Not really. I think it's just constant,
Constant.
probably in the morning it's maybe worse, little bit
Hmm.
puffy. My eyelid will be puffy a little bit.
I see, I see. And so is there any gunk or any discharge coming out of your eye or anything?
No, not at
No,
all.
okay. And do you have any redness in your eye?
Where exactly, doctor?
Like in the eye itself, like in the eye, like in the eye
The white,
itself.
the white of the
Yeah, the
eye?
white
No,
side
the
of the
white
eye.
of the eye is fine, doctor.
Okay, where do you feel the redness then, if there's any?
Well, sometimes my eyelid is a little bit scaly.
Eye, scaly, I see. Okay. And have you ever had something like that before?
The lump? No, no,
Mm-hmm.
doctor, at all. That's
First time.
first time, yeah.
I see. And uh, so two weeks ago, did it start like me like out of a sudden, or does it gradually build, or did it build up gradually?
No, it was a smaller, doctor. It's built up, increase in size gradually, and it keep
I see.
increasing. To be honest, and
It
I'm not
keeps.
sure. I become worried, doctor.
You said you become worried. Is there anything in particular you're worried about?
Well, when I start to read, doctor, they said it can be a cancer.
Cancer. Um, uh, is that what you're worried about?
Yeah, sure, doctor. Yeah, I can't imagine if that's a cancer. How? Oh my God, I hope not.
Well, we'll talk about that. Like right off the bat, it's very, very, very unlikely. But let me ask you a few questions just to make sure we're like what we're dealing with. Is that okay?
Yeah, sure, doctor. Yeah.
Yeah. Right off the bat, do you have any like did you notice any weight loss recently?
No, not at all.
Excellent. Any night sweats? Do you sweat at night?
No,
Any fever at all?
no, no.
No. Anyone in the family have any cancers or anything?
Um, well, I guess my grandma had
Mm,
had skin cancer, but I'm not sure which type of it. I think, but I
mm.
think, as I remember, she was going and they removed some, some bits of her skin, and that's only.
And do you think it's related at all to your eye?
I'm not sure to be honest, doctor,
That's
but it's
fine.
a bit of a worry.
Mm. I'll have a look at it and we'll discuss about it absolutely. And then if it's not, then I'm happy to discuss it further. Um, so how about your vision? Any changes in the vision at all?
No, no, my eyes. I mean, I didn't notice any. Or actually, I'm working in the computer,
Hmm.
or when I'm driving, I didn't find any problem at all.
Perfect. Excellent. Okay. Any other lumps or bumps in your body at all?
No, no, not
No.
I'm aware of.
Excellent. Excellent. Okay. You mentioned cancer. Do you think is there anything else you think it could be?
Uh, well, I thought it might be Stye, but then when I started to read, they said it should be painful, but and it's not painful. I can't also find
Mm.
any pointing, bus or something. So I'm not
Yeah.
sure, but it might be. I'm not sure.
Yeah.
What do you think, doctor?
Well, I think that like I think that you are like you look very like educated. What do you do? Like just a quick wrap up questions before I come to discuss what it is. Do you smoke at all?
No, doctor. I never smoke.
Excellent. Other than the depression that I can see and the sertraline that you take, do you have any other medical conditions at all?
No.
Do you drink alcohol?
Well, once in the blue moon,
Mm,
not
that's fine.
massive. Yeah.
Okay, excellent. And what do you do for a living?
I'm a makeup artist.
That's amazing. That's so cool. Okay. So, uh, look, Juan, from looking at the picture, it seems to me like the first thing that came to my mind is it a sty? But as you mentioned, styes are usually painful and is usually in the lower side of the eyelid near the eyelashes. Um, it still could be a sty, especially that you mentioned that there is some greases around your eyelashes. There is something else um, that I'm thinking about. It's called a chalazion. Have you heard of that term before?
Oh, what's that?
Chalazion is a um, uh, like a fatty cell deposit, or like the fat cells are kind of a little like gotten like grown up a little bit and made it like a fatty cyst.
Yeah, but
Um,
I'm not fatty, doctor.
no,
I'm
no, no, no,
slim.
no, no, no. They're sorry. It's the like the fat cells. It's just a cyst that has some fat in it.
Okay.
Yeah, it's not related to your like to your fat in the body or anything. Sorry about that. Um, uh, so the treat most probably again, I don't think it's cancer because the risks of it being cancer is very, very, very low. Um, does like there to treat that, we have a few options. Um, option number one is wait and see, and then it'll go away. It usually goes away within like 4 to 6 weeks. Option two is to make a referral to the eye specialist, and then they might look at it, examine it, and see what would they do. What do you think?
Um, it just doesn't make sense, little bit, doctor. So
Mm,
why shall I choose which one, or what is the usual
It's
pathway?
yeah, it's really up to you. Like if you want to wait and see, and then see if it goes away on its own, or if you want me to make a referral, I'm happy to make a referral.
Uh,
What do you think?
just so how it will go by its own, doctor, and actually,
Yeah,
why it happened from the beginning?
yeah. So sometimes we have some ducts, like the eye ducts or the tear ducts in the eye. Sometimes they got blocked with that like the fatty cells that I talked about. And then if they get blocked, they swell up and they make that cyst.
Okay.
Sometimes these can go in on their own, but sometimes they need some intervention from the specialist.
What they usually do, doctor? Like what intervention?
Sometimes they might do like a tiny little procedure
Procedure.
to remove
Okay.
that.
Oh, oh, so they will cut my eyelid.
They will cut the inside of it just to take the cyst out.
Okay. No, I guess I'm not fan of cutting my eyelid, to be honest, doctor. So I think I will wait and see, but there is any drawbacks?
Yeah, so it might get like sometimes it might get worse, right? So that cyst might get a little bigger. Um, Sometimes it might get infected and stuff. However, what I would say is if it stays the same, and if you wanted to keep it as is and to wait and see, wait for about a couple of weeks and see if it gets any better or anything. Um, if it didn't get better, how about we send a referral to the specialist? What do you think?
So for how long I should wait?
About 2 weeks, and I'm happy to make a referral, to give you an appointment right now for 2 weeks to see you later. Is that okay?
Yeah, sure.
Yeah. Now, things to look out for. I told you it might get bigger or might get infected. So if it got bigger to the point that it is obstructing your vision, or if you feel that it is hot and tender and painful, you need to seek medical attention. Either call us or call 111. If it starts to bleed as well and it's obstructing your vision, it could be an eye emergency, so you need to call 999. Does that make sense?
Yeah, sure, sure, doctor. Yeah, yeah.
Do you have any questions for me?
No, no, thank you, doctor. No.
Okay, take care. Okay, thank you.
Take care. Take care.
Thanks.
Well, well done. Okay.
Thank you.
Yeah. So you can hear me.
Yeah, hello?
Yeah, you can hear me.
Yes, yes, I can.
Yes. So whenever the patient coming with Chalazion or Stye, okay, you need to try to search for the root cause of the
Mm.
lesion, isn't it? And she told you my eyelid is scaly. And
Hmm.
if you can have a look here, what you can
Oh,
see
yeah.
here.
Like it could be like an eczema, like a periorbital
Exactly,
eczema or something. Yeah,
exactly,
you're right.
exactly. Okay,
Mm-hmm.
so just yeah, and this is the trick in these simple cases. So
Mm.
don't expect an examination that you intend to finish, and then after finishing it, you will become, member of Royal College in the UK, either GP or either emergency or internal medicine or whatever is that will give you a simple case that might be,
Tricky.
might be
Yeah.
treated with the pharmacist or with the nurse. Okay, they need to see
Mm.
that you are looking in a broader spectrum, okay,
Mm-hmm.
and the patient as a whole. So be careful because she told you my eyelid
Mm-hmm.
was scaly, so this could be seborrheic
Mm-hmm.
dermatitis. Does she have eczema? And we don't know.
Mm-hmm.
And then you didn't even relate it. So she is makeup artist, is yes? So
Mm-hmm.
what usually they are doing, the makeup artist?
Oh, they put some
Yes,
like they work with
yes,
chemicals and
yeah.
stuff. Yeah.
So usually before, they are testing the product before applying it to the
Mm-hmm.
customers. Yeah? So
Yeah.
you needed to relate that to her work, okay, and ask her,
Mm-hmm.
okay. The other thing that I feel that you needed to explore more was the anxiety, isn't it? You know that anxiety
Mm-hmm.
and depression is
Yes.
one of the precipitating factor or flare-up factors of eczema, isn't it? So
Yeah.
you did ask her that she's taking the medication, but you didn't double check her mood, isn't it? Actually, if you ask her,
Mm.
she will tell you she's stressed, she's short of money, and she just separated from long-term relationship.
Oh,
Okay,
yeah.
after 10 years being, with the long-term relationship, she just separated from her boyfriend, and
Mm-hmm.
so that need to be addressed as well. Okay.
Yeah.
Um, so, and then coming to the management, okay, is the management of the Chalazion is just wait and see?
I think from just from my like memory is wait and like I think for this tie it's wait and see and warm pressors. For Chalazion, I at least in my mind wait and see, and then if it goes on its own, like with warm pressors, then if it's not helping, then this referral.
Yeah. So number one, anything in the eyelid is eyelid hygiene. Yes, you need to
Mm,
do eyelid hygiene, isn't it? This is number one, and then
mm-hmm,
warm compresses, which makes sense because you need to do some warm compresses to make
mm,
the fat little bit fluidy, and then do some
mm-hmm.
massages, and that will try to open up the
Absolutely.
blocked duct, is it?
Yeah.
So it's not only wait and see, so it's wait and see and do
Mm-hmm.
something,
And do,
okay?
yeah, you're right.
So take care of that, and then you need to be
Mm-hmm.
specific, okay? After 6 weeks or 4 weeks, it didn't, it's 4 to 6 weeks. If it didn't improve, we need to refer you. So it's not an option. So it's not like, do you want to choose
Mm-hmm.
this or so? If she told you, okay, I want you
Mm.
to go for a surgery, would your referral will not be sound, so it's not clinically
Ah, I
sound.
see.
So first we will need to do this. We will wait and see. We'll give it chance that, with the massages and the hot compresses. Okay, and you
Mm.
need to say how to do the hot compresses, because also add the,
Mm-hmm.
moist hot compresses is not advisable because it can invite infection. So usually you are putting,
Mm.
hot water bottle, okay, or warm water bottle, and put it on the eyelid and in circular motion. Okay,
Mm-hmm.
3 times a day, 5 minutes every time. Okay, that's how we need to treat it, and then address the precipitating factor. If the patient has,
Mm-hmm.
rosacea or eczema or seborrheic
Mm-hmm.
dermatitis, that need to be treated. Okay,
I see.
and then also exclude, the red flags should be here, the infection, as you said, okay, and
Mm-hmm.
distortion in the eyelid or the vision. Coming back to something important is what are the signs of red flag signs for patient having eyelid cancer?
Mm-hmm.
Okay, because it's different than
A
the
regular
red
cancer,
flag,
your general
the
cancer.
regular general cancer. You did ask about the general cancer symptoms, okay? Yeah, it might be there, but it's less
Mm-hmm.
likely because usually if there's a cancer, it is skin, localized skin cancer, okay? And it's valid to worry about that because she had, her,
Uh, her
relative have a
grandma has
cancer, yeah.
cancer. Yeah.
So usually the eyelid cancer, okay, you will have distortion in the continuity of the eyelid, loss of
Mm-hmm.
eyelashes, okay. Recurrent stye is one of the things that you need to think about,
Mm-hmm.
the eyelid cancer. Okay, so the red flag is little bit different. So
Mm-hmm.
if we have a look, and also the definition of the definition of the Chalazion. Um, so I was not quite. Yeah, you said fat cell and this a little
Mm-hmm.
bit. I think little bit need to be refurbished. I think the
Yeah, yeah.
definition. So if you would like to rephrase it, how you will phrase it?
I would say probably I confuse the patient by saying like fat cells and stuff.
Yeah,
So
yeah. Try,
maybe,
try to avoid saying fats for a lady.
yeah.
Okay, always
I,
try
I,
to avoid.
yeah.
Okay, yeah. So
Probably I would say like a block duct. Yeah, a block duct that get assist in that duct. Yeah.
okay. Well, usually I give them the definition of the tear film. So I would tell them, okay, well,
Mm-hmm.
the tear film itself is made of multiple layers. One of them is the watery layer, okay, and to prevent the evaporation of this water, we have a little bit of greasy layer, okay, and that's produced by certain cells, okay, or certain glands in your eyelid, and when these glands are blocked because of the greasiness of the secretion, will build up and cause the cyst.
Mm.
Okay.
Yeah.
So I didn't say fat, I said greasy.
Mm-hmm.
Yeah, and then I
Mm-hmm.
give also a sense because most probably the patient will feel that his eye is dry because
Yeah.
the tear film will start to evaporate, and then either will be excessive irritation to the eye and watery, either it will become dry. Okay, so
Mm-hmm.
that will make sense little bit about the pathophysiology, and the patient will understand his symptoms. Okay,
Yeah.
so as you can see, the red flags of any eyelid lesion is distortion
Mm-hmm.
of the eyelid margin, okay, loss of eyelid lashes, and then recurrent chalazion, skin ulceration or bleeding, and then also vision problem, which you already asked about it. Okay. Also, give her the warning sign of the infection as well as the warning sign of periorbital cellulitis because it's an emergency. So orbital cellulitis or periorbital cellulitis is need to be treated with systemic antibiotic. But still, if you find
Absolutely.
that any soreness and redness of the skin around the eye, that's something we need to know about. Okay, so that's as a general feedback. I will close now the recording and then I will give you your specific feedback. Okay, just 1 minute.